Yeah, first, I just want to thank Jill for giving me this opportunity to kind of share the value of my position as an immunization program manager for Corewell Health. Just a little bit about my background. I'm a nurse by trade. When I graduated from nursing school, I worked in Peds ICU for about 10 years. And I saw a lot of these vaccine preventable diseases in the ICU. I'm dating myself when I say that I saw vaccine preventable diseases. I then worked in a pediatrician's office for a little while, gave immunizations in the front line there, and then went to the Ottawa County Health Department. I worked there for about 5 years before taking this position. As I was making these slides, I realized just how much work I actually do. And so while you're listening to my presentation, I want you to try and imagine the clinical staff in an office adding all of these on top of their normal work duties, which is what they're trying to do right now. So when I started at Corewell Health, it was then Spectrum Health back in 2014, basically just had my job description and that was it. And they basically just said, go do what you do. So I started to develop my own program, which was a great opportunity for me. And in my program, the foundation of this program really is the immunization champions. I know they're required for VFC sites, but I identified immunization champions in any office that offered vaccines, including specialty sites and IM sites. I built a rapport with these champions and then provided education and guidance and really saw a substantial improvement in the quality of our immunization program. And I'll share that with you kind of at the end of this presentation. But in order to build that rapport, the first thing you need to do is gather your information. So I actually spent a few months visiting each of our immunizing offices. I asked engaging questions, actively listened, complimented the good things they were doing, and then just kind of courted all this information. So what type of office was it? What immunizations are provided in that office? What do they use for storage and handling and temperature monitoring? What types of resources or tools do they use? Were they aware of their immunization rates? Most offices aren't. What's their workflow? What do they do the best? Let them brag a little bit. What do they feel they could improve on? And then how could a program manager position really support you best? They were my customers, right? So what were they looking for? And then once all that information was gathered, I had to decide what good looked like to me. So here's where you might want to establish metrics you'll use to gauge success. I really wanted all of our offices to be standardized. It's much easier for education that way, right? And then obviously to increase immunization rates. So implementing your plan. First, you need to know the basics, right? What were your biggest gaps? Where do you want to start? You eat an elephant by taking one bite at a time. Make sure you're providing the immunization rates to those offices. You can't know if you're improving if you don't know where you started. Most of our offices thought they were doing well and were really surprised when I shared their immunization rate. So what you really want to do is set up these offices for success. Knowledge is power. When I gave immunizations in the pediatrician's office, I gave them because the schedule said they were due. When I worked at the Ottawa County Health Department, it took me about a year to feel really comfortable in the diseases and the schedules. And that's the why we're doing things, right? If you know the why, it makes you much more likely to do the right thing. So we started education for new employees. So all new employees coming into our system, whether they've been giving immunizations for 2 days or 20 years, go through this new employee education. We talk a little bit about each of the diseases. We talk about the vaccines that prevent them. We go through schedules. We talk through our standard work and then preparing and administering vaccines. We also provided each office with an immunization resource binder that's updated each year. In that binder are things like latex and vaccines, allergies and vaccines. Quick looks are in the back of there, and we just tell them to make sure that they know what's in that resource binder so they know what they have there in case they need it in the future. And then just providing guidance with vaccine questions. This is just the start of the things that this position does. You have to stay up to date too, right? So I began providing monthly IMS champions meetings. You can see here they're via Teams, and there are over 200 participants invited. In these meetings, we talk about whatever's relevant that month. So new vaccines, current disease outbreaks, insurance coverage, temperature monitoring, I guess anything that's really on my mind that month. I answer questions and allow IMS champions to share their best practices. That's been really valuable. We have a monthly newsletter that's circulated. It focuses on a different immunization each month, adds information on current news, important reminders. For example, it's time to pre-book your flu vaccine. And then there's a medication safety corner. Any new vaccine that comes out requires vaccine education prior to use in the office. Had a lot of that lately with RSV and COVID, right? There were times that myself, one of my team members, and a pharmacist were looking at the COVID recommendations, right? All kind of like, what is that wording? When do they get that dose? If you can imagine just one MA or even one RN in an office trying to figure that out without those second eyes, it's very difficult. And then we also have a SharePoint page where IMS champions can go to find web links or information that has been shared in the past. While we're supporting the sites, there's a few different resources that we have. We can do a VFC site visit prep. So I could go in and just do a practice run before they have their VFC site visits. We work with offices on storage and handling. Did they have an out of range event? Do they need to call manufacturers? Who do they need to report that to? Basket labels. So when a new immunization comes out, right, we use the CDC basket labels, but we submit those to our document services to be printed so they have all the right basket labels or syringe labels. Inventory management, and then tip sheets and quick references. Not only do I work directly with the offices, I'm also a liaison for our offices with their local health departments, MDHHS, MICR, and other health systems. So I like to think that my collaboration with these entities also makes their jobs easier. Once your program's up and running, you're going to want to continuously monitor and make sure you're seeing success. So things you might want to monitor: immunization rates. Are they improving? Immunization champions. They switch frequently, trust me. Vaccine loss. Is there less vaccine loss in those offices? Are there errors decreasing? Are there health department site visit results getting better? And then staff satisfaction. That's an important thing also. And then evaluate. So where were you then and where are you now? So I can share where our health system was at the time I was hired and where we are now. So in September of 2014, our pediatric immunization rates were 52%. January of this year, we're at 76%. Our peds rates high was 83%. That was before COVID, unfortunately. And then if you look at our adolescent rates, we were 21% when I started in this position. And as of January of this year, 46%. And our adolescent high was 56%. And although immunization rates are important, and that's a focus for the state, there are other things that really need to be celebrated. So I asked some of my IMS champions, what do you think about this position? And here's just some of the responses that I got. Beneficial resource to troubleshoot immunization questions, increased awareness of recommendations. It helps increase immunization rates, ensures the safety and wellness of our patients, helps navigate through immunization changes, and valuable education and timely resource. And then from one of my teammates, I got this statement, which is very nice. Having an immunization coordinator has been an absolute necessity to day-to-day operations with new vaccination rollouts, changes in vaccine schedules, indications, new employee education, and ultimately improving our vaccination rates in our individual offices and healthcare system. Without the focus on immunizations and the work group coordination through the Immunization Champion Program, our teams would be unprepared, struggling for resources, and variance in practices across the organization would be common. This position has solidified a go-to person to create initiate, and sustain good practices across the system. So once you have that program going, it's wash, rinse, and repeat, right? Implement, monitor that new implementation, then evaluate how that was. What's the next thing you're going to work on? Implement, monitor that, and evaluate. And I am happy to answer any questions that anyone might have. Um, this is a position that obviously is ongoing with all of the changes in immunizations, all the changes in CDC requirements. I don't know how offices or health systems do it without a full-time person really to be paying attention to all the changes.